Good morning, everyone, and welcome to the Wednesday, October 13th COVID-19 response media briefing. I'm Julie Grauert, your facilitator for the event. I'd like to welcome our panel for today. From the Washington State Department of Health, we have Dr. Umair A. Shah, Secretary of Health, Michelle Roberts, Acting Assistant Secretary, Lacey Fehrenbach, Deputy Secretary for COVID-19 Response, and Andrew R. Rose, COVID-19 Incident Commander. Our guest panelist today is Dr. Frank Bell, who works in pediatric infectious disease at Swedish Medical Center and is also a member of the Washington chapter of the American Academy of Pediatrics Board of Trustees. To begin today's briefing, we will open with remarks from Michelle Roberts. Go ahead, Michelle.
Well, good morning, everybody, and welcome to this week's briefing. I'm Michelle Roberts. I lead the state's COVID-19 vaccine planning and distribution team. Vaccination rates continue to move in the right direction. We really continue to be pleased and optimistic about this news. We've given out more than 9.3 million doses to more than 5 million people. That's an incredible feat. More than 77% of the state's eligible population has received at least their first dose. And more than 71% of people 12 and older are now fully vaccinated. Every day, we're getting closer to our goal of vaccinating everyone who's eligible in Washington. The COVID-19 vaccine protects you, your family and friends, and your community. You can head to our vaccine locator website to make your appointment today if you need to be vaccinated. Vaccines for kids under 12 are getting closer to becoming a reality. I know there was a lot of parents and guardians who are anxiously awaiting that news. Last week, Pfizer asked the FDA to authorize its vaccine for kids aged 5 to 11. We expect the FDA to meet later this month, and the CDC's Advisory Committee on Immunization Practices is expected to meet in early November. These are familiar steps, the same ones all authorized COVID vaccines have taken. We are hopeful vaccines will be available for younger kids soon. We continue to follow guidance and recommendations from our federal partners and will update you as soon as we have more information. Until then, let's continue to focus on getting our older kids vaccinated. All 12 to 17-year-old children are eligible for the Pfizer vaccine today. And so far, half of that population is fully vaccinated. I also want to talk a little bit about vaccine verification. Vaccine verification is becoming more common at restaurants, businesses, and events, which is why it's a good idea to keep your vaccination card handy. The good news is you can access your vaccination records online by going to myirmobile.com. MyIR and MyIR stands for My Immunization Record. MyIR Mobile is an internet-based portal that gives you access to your official state vaccination records. But if you're heading somewhere like a Seahawks game where you have to show proof of vaccination, don't wait till the last minute. Get your mobile vaccination record ready now. And if you need help accessing your records or making sure your account in MyIR matches, you can call the state COVID-19 hotline at 833-VAX-HELP. The more people that are vaccinated, the better off we all are. If you haven't been vaccinated yet, it's not too late. Every day, people are choosing to get their first dose of vaccine. If you have questions, visit DOH's Frequently Asked Questions page or talk to your trusted healthcare provider. Making a vaccine appointment is easy. You can visit the state's vaccine locator website or vaccines.gov, where you can even search for specific vaccine types. You can also find vaccine locations near you by texting your zip code to GetVax, which is 438-829. Or you can also call the COVID-19 hotline at 833-VAX-HELP. Someone can help you schedule your appointment if you need that type of help. Don't forget, you can get the COVID-19 vaccine on the same day as you can get other vaccines, like your annual flu shot. And now is the time to go ahead and get your flu vaccine. We recommend getting it this month if you haven't been vaccinated yet. Thank you. Back to you, Julie.
Thank you, Michelle. Next, we will go to Dr. Frank Bell. Go ahead.
Thanks, Julie. Good morning, everybody, and thank you to the department for the invitation to join you and speak this morning. As Julie mentioned, I'm a pediatric infectious disease physician with Swedish Medical Center and also serve on the Washington chapter of the American Academy of Pediatrics Board of Trustees. It's been really exciting for us as pediatricians to see our kids getting back into school in this last 6 weeks or so. I think it's something of a return to normalcy for them, and just the joy of being back in connection with their peers and with their educators in the classroom. But as I've gone back to sports and to school, it's just a reminder to us that we need to take every measure we possibly can to keep our kids safe. COVID is not taking a holiday, and with variants in Delta, we need to take every measure we can to try and protect our kids. And it's clear from what Michelle has just said, that the most important aspect of that is to vaccinate kids who are 12 and older. We have vaccines that are safe, highly effective, and powerful against Delta and the new variants. So really, I think there's every reason for us to feel confident this is something we can do that really helps protect our families. Again, as Michelle mentioned, for children too, these vaccines have gone through the same measures that we would do for most of our normal childhood routine vaccines. And we know that very careful review process hopefully will extend the emergency use authorization as the month goes on to younger kids. But 12 and older, I think we're just increasing confidence that this is the way we can safely keep our kids back in school and back to the activities they've missed out on so much for the last year and a half. As parents, of course, it's natural that we all have questions about vaccines, and that's normal. And we just encourage you as pediatricians to get out to your healthcare providers for your kids, to pediatricians, to family medicine physicians, to nurse practitioners working in primary care, and just have a conversation. We're here to support you as parents and guardians. We know that this is not for some folks the easiest and the quickest thing to jump into, but we've learned a lot. We've learned an awful lot in the last 18 months, and we know that this is something, COVID is with us, not going away. We know how to keep kids safe in the classroom and back in their activities. So look out for somebody, search that conversation. We're here to support you and do our very best to keep you and your family safe and give you the information you need to make that decision about care and vaccines for your children. That's it for me.
Thank you so much, Dr. Bell. We appreciate you joining us. Our next speaker is Lacey Fehrenbach. Lacey, go ahead.
Good morning. Thank you everyone for joining. I'm Lacey Fehrenbach, Deputy Secretary for COVID-19 Response. I'm going to share high-level disease trends with you. We are seeing some signs of improvement, but disease remains high across the state. We're encouraged that we're going the right direction, but we have a long way to go to get through this Delta wave and prepare for the winter respiratory virus season. Based on data reported to our disease reporting system, cases are decreasing statewide and across all age groups. This includes school-age children. As of October 3rd, the 7-day rolling average is 2,558 cases, and that correlates to a 7-day case rate of about 234 cases per 100,000. So still quite high. You can see on the graph similar to early January. Our hospitalizations are also decreasing for a few weeks now. Our 7-day rolling average is 122 new hospitalizations, so that is quite high. Our current 7-day rate is about 11 per 100,000. So that's, you can see there on the graph, a little higher, getting close to where we were at the peak of our winter surge. So more work to be done. When we look at our WAHealth data, COVID-19 hospital occupancy is at 18%. This is a decrease from the high of about 25% in early September, but still well above our goal of being less than 10%. Total occupancy remains high at about 91%, and ICU occupancy is sitting around 88-89% from day to day. COVID-19 ICU occupancy is at 29%. That's a decrease from our high of 37%. A move again in the right direction, but still above our goal of being less than 20%. I want to remind folks, we continue to see that the majority of people hospitalized with COVID-19 are people who are not vaccinated, and the vaccine offers extraordinary protection against severe disease. unvaccinated people who are 12 to 64 are 19 times more likely to be hospitalized with COVID-19 compared to those who are fully vaccinated. And for people 65 and older, you are 9 times more likely to be hospitalized for COVID if you are not fully vaccinated compared to those who are. So, taken together, the healthcare system, is getting a little bit of relief, but is still very, very stressed and stretched. And we expect that this will continue because disease is high. There have been delays in care, and we have other respiratory viruses coming our way as the fall, winter months approach and gatherings begin happening. So our ability to continue on this trajectory really depends on the public continuing to step forward to get vaccinated and wear their masks. These are positive signs. We want to recognize that progress, but we've got to keep rowing together to protect our communities and our healthcare system, as well as our families. So I do want to talk about holidays because they are coming up for many of us. And my first and most important message is that if you're going to gather for any reason, please get vaccinated, both for flu and for COVID-19 if you have not yet. It is hard to believe, but Thanksgiving is 6 weeks away from tomorrow. So if you are not yet protected and have not yet received your COVID-19 vaccine, you have time to get that full protection before that holiday. And you'll be protecting yourself and others with whom you may gather. So please call 1-833-VAX-HELP, talk to your healthcare provider, get your questions answered, and get your family protected. Whatever the gathering, please wear your masks when you are indoors with people from outside your household or in crowded outdoor settings. Wash or sanitize your hands or the hands of your little ones often. That's important for all of our respiratory viruses. And outdoor activities and gatherings are safer than indoor ones. You can take your kids trick-or-treating around the neighborhood. We would recommend limiting indoor Halloween activities, especially if you have kids that are not yet eligible for vaccination. Whether it is a holiday or a football watch party or something else, try to gather with your family and friends outside. And if you do gather indoors, make sure you have good ventilation. Turn up your air system. You can even open a window. That helps. In either case, you can consider having your guests take an at-home test before the gathering just to make sure everyone is as safe as possible. And importantly, stay home if you're sick, have any symptoms of COVID-19, or were recently exposed to someone with COVID-19. Working together, we can stay on this hopeful path, can keep ourselves and our loved ones as healthy as possible during these fall and winter months, and ensure that our healthcare system can continue to meet the critical needs of all Washingtonians who need care. And importantly, as Dr. Bell mentioned, keep our students as safe as possible in their classrooms and there in person for learning. Back to you.
Thank you very much, Lacey. And our final panelist before the reporter question and answer period is Secretary Shaw. Go ahead.
Thank you, Julie, and thank you to our team, Michelle and Lacey and Andy, for joining, and certainly I want to thank Dr. Bell for his remarks related to what we're seeing around the state and the concern around pediatrics, especially as we continue to see kids in school and also see vaccines right around the corner for 5 to 11-year-olds. I want to highlight a few things and just reiterate a few points that were mentioned from what you just heard. First of all, let me start by just saying good morning to all of you, our media partners. Just want to thank you for the continuation of being here with us throughout these very difficult months. And we have some positive news, which is, as Michelle mentioned, we have absolutely crossed the 9 million mark for vaccine doses given in the state of Washington. And we do know that pediatric, between the ages of 5 and 11 vaccines are right around the corner. In fact, if we're not good at predicting this, but we're hopeful that by the end of October or the beginning part of November, well before Thanksgiving, that children who are in the ages of 5 to 11 will be eligible for COVID vaccine as well. The other thing that's been really important is watching disease trends, as Lacey just mentioned, and we continue to have a very high number, as was just shown. But the good news is that we have started to see a leveling off, and in fact, decreases, which is important for us to keep in mind that we're not out of the woods yet, but at the same time we have made tremendous amount of progress. This is just not only for community cases, but this is also for hospitalizations. It is really important for us to continue to do everything we can to support our healthcare system. As we know, our healthcare system has been stressed. I've talked before about the rubber band and the stretching, and we want to do everything we can to continue to support. So while it's stressed and it's stretching, and we want to do everything we can to support the healthcare system as hospitalizations continue to be at a very high number, very high rate across the state of Washington. So we want to obviously continue to focus on our vaccination efforts, including the vaccinations that are now the booster doses that are happening across the state, as well as other mitigating factors such as wearing masks and avoiding crowded situations, crowded settings. We know how critical it is for everyone to do their part to fight this pandemic. We also know that October 18th, the deadline for many state workers and healthcare workers and K through 12 educators and staff is right around the corner. And while October 4th was the last day to get the J&J vaccine, I do want to encourage anyone who is still on the fence or not certain that they want to get the vaccine. I would ask them to really consider starting their vaccine process as quickly as possible, especially before the October 18th deadline if they're in any of those categories of workers. And that certainly includes the J&J vaccine, the one shot, but also Moderna and Pfizer. A couple of other things that I wanted to just make mention is that, like most healthcare settings across the country, we're seeing an up and down throughout the country when it comes to what's happening with hospitals and healthcare workers. We're seeing in certain parts of the nation, we're seeing an increase. The mountain states are seeing those increases. You've seen what's been happening in states around us like Alaska and Idaho and Montana, for example. But you're also seeing this incredible difficulty that all hospitals and healthcare systems are having when it comes to trying to take care of people who at this point have a largely preventable illness when it comes to COVID-19. So again, the reminder, as Lacey showed, the percentage increased risk if you were unvaccinated. And we want to just encourage everybody to talk to your healthcare provider, talk to somebody you trust, talk to someone who has good, credible information. And we have done a lot of things on our DOH website. We have myths that are on our website that will also help people do everything they can so that they do not have misinformation, which is really unfortunately driving people not to get vaccinated. As you can see in what was just brought up again, that you are markedly more likely to be hospitalized if you're unvaccinated than if you are vaccinated in all age categories. And this is really critical, really important, and really concerning to all of us. We also are continuing to hear from our healthcare partners about the concern about staff shortages. It is really important for us to be able to do everything we can to support our healthcare workers. We know that some folks may have decided not to seek care and delayed care. And we do know that the healthcare system will continue to have an incredibly important role in handling the individuals who are not just sick with COVID-19, but other reasons that they are seeking medical care. So we want to make sure that we're doing everything we can to support, as a community member, to support our healthcare system. Last week, the ASPR, the Assistant Secretary for Preparedness and Response, was here in the state of Washington, was actually at Harborview Medical Center, and was also visiting with us at Department of Health and the Washington Medical Coordination Center. I really want to recognize WMCC's continued efforts to help with transfer of patients across the system, as well as tracking and monitoring what's happening across the healthcare system and hospital capacity across the entire state of Washington. I will say that the ASPR was very clear that the federal government was going to do whatever they could to help and support the state of Washington, just as it's doing across the country. And I know Andy Rose is on. I'm going to turn it to him for just a moment, Julie, before we get to the Q&A. We have been awaiting some of those federal resources. And the good news that I have is that it appears now that those federal resources that we requested, that the governor requested from the White House, that I requested from Health and Human Services, that those resources are now starting to arrive in the state of Washington. I want to be really clear that these resources are not going to solve the entirety of the challenges. The entirety of the challenges will be a combination of what's happening in those healthcare settings, what we all do as community members, and also the work that is going into the coordination across the state system. I want to thank our Health and Human Services sub-cabinet at the state, not just DOH, but Healthcare Authority, DSHS, DCYF, the Washington Benefits Exchange, and other partners at the state who are continuing to work together behind the scenes, do everything we can to assure that the resources are available so that we can work together to support our healthcare system. Some of those things that we've been doing is access to safe healthcare for people across our state when and where they need it, which means that we're continuing to work on modifying rules or creating waivers to support healthcare surge response, convening partners and stakeholders along complex health-related issues. We certainly continue to fund and support coalitions across the state related to health, as well as the Washington Medical Coordination Center, as I mentioned. We're also obviously working together on state's emergency supports function, which is ESF 8, which is public health, medical, and mortuary affairs, and certainly everything we can to continue communicating with not just the public, our elected officials, our community members, and certainly system partners. We have also been working on the guidelines for crisis standards of care that would be used in a situation where we did not have enough resources across life-saving or life-threatening resources across the state of Washington. Thus far, with things as they are currently, I do not see in the immediate future where we would have to utilize or implement crisis standards of care guidelines. But I will say that we're doing everything we can behind the scenes, one, to make sure we don't, and number two, to make sure that we have those guidelines in place. I also want to just mention that at the end of the day, we're doing everything we can also to continue to focus on vaccines. And I do want to give a highlight that the VAC Center, the Vaccine Action Command and Coordination Center, if you remember, that was led by Dan Laster, that we initiated back in January. That VAC Center has been recognized as a national leader and model during the vaccine rollout, but we also released a report highlighting the milestones that were achieved during the last several months of that VAC Center work with 50 plus partners from across Washington. And that example of public-private partnership is really key to the work that we've been doing. And the last thing before I turn to Andy is just to say that I was in Spokane as well as Grant County and Chelan Douglas 2 weeks back. And as I was working with a lot of the different groups that were out there in those communities, one thing that was clear that everybody was saying is that we know that this is very difficult for all of us, but everybody was so committed to working together. And that is why it is so critical that we continue to work together as we move forward. So with that, Andy, I'm going to turn it to you if you had any additional comments, and then we can turn it back to Julie after your remarks. Thank you.
Thanks, Dr. Shaw. And yeah, good morning, everybody. I'm Andrew Rose. I'm the Department of Health's COVID-19 Incident Commander. Glad to have the opportunity to be here this morning and really share some insight into the background of what's going on with supporting our healthcare and hospital surge. So I'm going to channel my inner Dr. Shaw and talk about the 3 C's real quick. So really the foundation of this is communication, collaboration, and creativity. Dr. Shaw mentioned a lot of the folks that we have worked to bring together to work on this issue, along with our hospital and healthcare systems, our Washington associations around the Hospital Association, healthcare coalitions, and our public health partners to really engage and move this work forward. DOH is only a part of the overall body of work around supporting our hospitals and healthcare systems during this pandemic and staffing crisis. While we do lead the support and coordination of this effort, we are very aware that it's a national issue and one we are all coming around to help support within our state. DOH does have and is actioning several options within our scope, and you've heard Dr. Shaw mention them. The first is our state to federal resource requests for assistance. Currently, to date, as I sit here talking to you, we have 2 requests into the federal system for federal resource support, and we are waiting final notification from our federal partners on those 2 resource requests. If they are approved, we will definitely communicate what and when those resources are and when they will be showing up and where they will be deployed to. The second is our GSA contract from the General Services Administration. We put this out for bid several weeks ago and had one contractor apply, and their name is ACI. We have been working with our multi-agency coordination group over the last several weeks to identify resource needs that we can utilize this contract for. And I'm happy to announce again today, we have 2 facilities that have finalized their contracts and will be expecting resources to arrive at their doorstep here in the next 7 to 10 days. I will say that if there's any further information that folks want on where those resources and what those resources are, I would point to our DOH PIOs. And again, you will hear that contact information at the end of the press briefing today to help alleviate burden on our local facilities. They are pretty stressed, and we want to make sure we help coordinate information flow to alleviate that burden for them. But again, this has been a Herculean effort spread across many state, local, and private sector partners. And I am very pleased to say that this process has worked great to help us bring much needed resources at this time to our facilities. And I know there's some more questions we'll follow up with here in a minute, but I think I'll stop there. Dr. Shaw, back to you.
Back to Julie. Thank you, Andy.
Thank you very much. We're playing a really competitive game of ping pong here. And that brings us to our reporter question and answer portion of the briefing. We have 6 reporters in the queue right now, and we're going to kick it off with Ariel from the Spokesman Review. Go ahead.
Great, thank you. My question is, where is the Department of Health going to target those federal resources and how that prioritization process will work, assuming that facilities from all over the state have asked for help? And then is the delay in procedures and surgeries going to continue in our hospitals in the coming months? Thank you.
Yeah, Ariel, thanks for that. And I'll kick that back over to Andy. Let me just really quickly just take on your second question first, which is that we know undoubtedly there are delays, and we do know that gladly speaking that our clinicians are working with their patients on making decisions on which delays are okay and which delays are not okay, and that they do need to get individuals into the healthcare system. I will say that it is true that it is only a certain amount of stretching that a system can eventually do before it is no longer able to stretch anymore. But that said, we're doing everything we can to hopefully be able to mitigate those delays over time. That will be difficult, though, unless we all do our part, and also difficult if we continue to have the real strain on our healthcare resources, including staff shortages. So this is why the federal resources are key, but they're not the only thing we're doing. I think that's the key message that we're trying to really get across, is that that is one part of the puzzle. It is not the entire part of the puzzle. It is not the entire puzzle. Andy, actually, before I turn it to you, Dr. Bell, if I could turn to you, did you want to make any comment about that? Because I know, from a clinical standpoint, that may be something that, as you're seeing in your Swedish clinical practice, on, this real, I know in pediatrics, they may not be the same as adults, but I wonder if you have any comments about, how the healthcare system is handling some of the delayed care in the system, which includes obviously well child checks and immunizations, et cetera.
I would just echo that we're feeling the strain and the stress, and some of it is new, and some of it is just the tension that comes with so many months of this applying ourselves to this key work. Certainly, our pediatric nurses have been able to show their flexibility and have been called in to support our adult colleagues and carers. We certainly are beginning to see some of the routine care that was being put off for children coming back. That's not true for vaccines, and you raise an extremely good point that we're really way behind on some of those routine functions of primary care. And I would just echo what Michelle has said, which isn't related to your question, but it's really important as kids come back, and I'm thinking about the COVID vaccine, that we use this opportunity to catch up on their routine immunizations. And again, co-administration is the order of the day here. Get those vaccines in the visits that we can. But our healthcare is certainly under some strain, and that's true of the pediatric floor as well as our adults and as those who are working in primary care. This is a big lift for us all.
Thank you, Dr. Bell. Andy?
Yeah, thanks. Let me handle this kind of in two parallel paths here. So let's talk first about federal resource requesting. Ariel, to your question, we have yet to have had to prioritize that. We have only had 2 requests so far go into the system. We do have a very outlined federal process that we have to follow for the state to request federal resources. Our 2 hospitals that have asked for that resource so far have done a great job in completing that process, and they are in the system now. So we don't foresee any need to have to prioritize that. If we do see a flood in of other facilities, we will tackle that as it approaches. However, on the contractual resource side of the house, our group, when I mentioned this multi-agency coordination group of all of our partners, state 24/7s, local hospital healthcare partners, this is what they meet on a daily basis and discuss. We have a pretty decent contract with ACI. The hospitals that need resources have identified what those are, and we are really working to finalize that prioritization process that focuses on the biggest benefit across the system, really starting to focus on our regional hospitals, which is where our smaller, rural, more critical access hospitals decompress to, and really freeing up the chain throughout the system by targeting these resources where they have the most benefit. And again, that is in the final process, but it is an all-together process with all of our partners to make that decision across the enterprise. Hope that helps.
Thank you. Our next question comes from Jessamine at Q13. Go ahead.
Thank you so much for your time this morning. I have a few questions. The first is, as we approach the October 18th deadline, this is likely the last time we'll be able to speak to you about it. Where is your confidence in the state's ability to protect the public from both a health department standpoint plus public safety as we're looking at attrition across the front lines? And my second question is, you mentioned that you were working on guidelines for the crisis standards of care. What prompted you to start working on that? And are you worried about it? Because I would think that contingency plan would be in place already.
Jasmine, first of all, thanks for the questions. Let me answer both of those, and I will turn it to Lacey and Michelle if they have any additional that they want to add, in particular around the October 18th vaccine deadline. On crisis standards of care, to be honest, this state is, we should be very proud of the work that's occurred in this state for multiple years. We have, from a crisis standards of care, which is called CSC, and I know this from my national work, Washington has been one of the leading states when it comes to CSC work across the country, and in fact started CSC work back in 2015. Actually prior to 2015, but 2015 when it really formally started to adopt guidelines and do additional work in a more formal fashion. So this is really on the heels of the Institute of Medicine's report that came out in 2009. And so I really want to recognize that this is 6 years at least in the making. This is not just 6 months or 6 weeks or 6 days. This has been going on for multiple years. What's happened recently, though, is that as you have guidelines, and this is a national phenomenon, all states are looking at refreshing those guidelines with what we have learned from COVID-19. The original letter report, I know this because I was on the committee, so this is why I have a lot of detail on this, back in 2009 was really designed for 2 types of events. One was a no notice event, like an earthquake, and the other was a slowly evolving event like an infectious disease, like a pandemic. And at that time, it was during H1N1, did not have to be utilized. Subsequently, here we are in a global pandemic that's not just like H1N1, a global pandemic, but a severe global pandemic. And that's why states across the country are re-looking at the entirety of the toolbox of CSC related guidance and the tools that should be or will be available to practitioners. But what we wanted to do recently, and this has been going on for some time, was to revise and review and revise those very guidelines to make sure they were consistent with what we have learned, what we've experienced during this pandemic, but also to make sure we were ready in case we had to unfortunately, as a last resort, have to pull CSC, the trigger on crisis standards of care guidelines across the state. Again, when you started to see what happened in Idaho and Alaska, we had states around us that were pulling the trigger on crisis standards of care, but we were very clear that delivering care in a crisis is very different than implementing true crisis standards of care, in where you are essentially having to make very difficult decisions on life-threatening, life-saving therapeutics or other resources such as ventilators. That is not the case in the state of Washington. We are continuing to move forward, but it has been very important for us to be ready for any scenario that comes down the future, if you will. We do not want to be in a situation where we have to implement crisis standards of care, but yet we want to make sure that we have those guidelines in place, that we can have them available to our healthcare partners, and that they can certainly be trained on those so they're aware how those crisis standards of care guidelines would work and how they would be potentially triggered or implemented if necessary in the state of Washington. Again, acknowledging that we never want to utilize them in the first place. So I know it's a pretty extensive answer there, but I wanted to be very clear on what's been going on. This is a multi-year process, and this is not something that just happened recently. This is something we've been doing on an ongoing basis. And it's really, sometimes people put a couple things together and think that it's triggered by something, and it's that we want to continue to be ahead of the game. And when it comes to the October 18th deadline, yes, that is right around the corner. It's next week. And we continue to hear from our partners across all of the sectors that are potentially impacted. And we are continuing to monitor what's happening. Obviously, we're not going to know completely what's going to happen until October 19th. But I will tell you that the good news is that we're hearing, as you saw, even our hospital association this past week had released information about this, that the good news is it looks like the vast majority of people that are in those categories are getting vaccinated. And that is the goal of the requirements, is to get people vaccinated. It is not to do anything else, but to get people vaccinated. And certainly also to protect the very individuals that, for example, healthcare workers and others across the state who they are charged with being responsible for, caring for. We want to make sure that they also do not pass COVID-19 on from a worker to that kind of individual community member or patient. So I just want to make it very clear that yes, there's a lot that's moving forward. We are hopeful that anybody who is still in those work categories who has not gotten vaccinated yet can still do something about it and get vaccinated and really do everything they can to get into the mix so that they can continue to protect themselves, their loved ones, and certainly the community members that they serve. That is what this is about. That is why we are supportive of this requirement. We want to make sure we can do everything we can, especially when you see the statistics about, and when you're on the ground in hospitals and you're talking to ICU physicians and nurses who are strained and stressed, and they're saying 10 times or 20 times the risk for unvaccinated versus vaccinated, or 95% of the people that are in the ICUs are those who are unvaccinated. That is why it is so critical that we do everything we can to help people see why vaccines are important. I do want to make one quick comment that I saw a report today that there were, I believe, 476 law enforcement officers that have died of COVID-19 since the pandemic has started. That's a national number. That is 4 times the number of law enforcement officers who have died in the line of duty from gunfire. So that is incredibly important. It is so powerful that we want to protect the very people who are protecting us. So that is why we're doing this. And let's see what happens on October 19th when we have gotten past the deadline. Michelle, Lacey, anything you all want to add? Dr. Bell, anything from your end?
All right. Thank you very much, Dr. Shaw. We are now going to go to Rachel with the AP. Go ahead.
Hi, good morning. I wanted to ask Michelle or someone else, how many booster shots have been administered in the state to date? And when will we see that data broken out in the dashboard?
Yeah, thanks, Rachel, for that question. We're working on getting that data added to the dashboard, but what I can tell you so far is about 205,000 people in our state have had additional doses of vaccine. That's as of October 10th. That represents the number of fully vaccinated people who've received an additional doses of COVID vaccine on or after August 13th. We, unfortunately, just the way the data is collected, cannot break that out by people who've gotten additional doses because of immunocompromising conditions or people who've gotten additional doses because they're eligible for booster doses. So hopefully in the next week or two, we will have that added, some information on what will start out as a report on the website and then get it added to the dashboard as well.
Great, thank you. Our next question comes from Jake at King 5. Go ahead.
Good morning, all. Thanks for the briefing this week. We heard a lot about the flu season perhaps being the worst we've seen. Maybe a possible twin-demic. As we saw last season, though, it was not the case. What is it now that maybe makes you think we're facing anything different? And also, early in the pandemic, we had goals and benchmarks set by the DOH and by the governor as to when restrictions could be lifted. Is there any consideration into reintroducing those kinds of goals moving forward? Thank you.
Yeah, thanks, Jake. I may turn that last question to Lacey in just a moment. What I would say is that, one of the things last year, what we benefited from last year, this is obviously, it was the beginning of vaccines in the state of Washington or in the country. It was at a time when mask usage was very high, when we also had people who were doing all the other things like hand washing, avoiding crowds, and staying if either they were taking things outdoors or they were just staying away from others. What naturally happens during pandemics, especially when they come in waves up and down and they last for months and months and months, such as this pandemic has, what naturally happens is people forget all those other tools that are really important, not just for COVID-19, but also last year also importantly impacted flu season, so that the wearing of the masks and doing those other mitigating factors helped us have a very mild, if not almost a negligible flu season last year. Now this year, when you start to go back into the mix of people being fatigued from all those measures that are required to fight the pandemic, or thinking falsely that, hey, I just got my COVID vaccine, that's going to protect me from everything. It's not going to protect you from the flu. We want to make sure that that information is out there for people, that yes, you do need to protect yourself from COVID-19. Absolutely, we're focused on that, but you should also be doing those things for other diseases such as flu season, and influenza is right around the corner. Whether it's going to be a severe flu season, it's going to be hard to tell. Again, it really depends a lot on those factors that I just mentioned, but also it's going to be important for us to continue to monitor this. As far as the measures and metrics, Governor made it very clear that we were going to continue these measures as long as we continue to see increases across the state, which included the Delta surge. And the Delta strain surge, which has really led to increases in cases across the community as well as in our healthcare sector, that is right now would be not the time to relax those types of restrictions, because this is exactly what we're using to help us fight this current surge. So it's absolutely too soon for that. But when we see that those numbers, those measures, those indicators, whether cases, hospitalizations are now safely coming down, and there is no concern that they are going to rebound very quickly back up if those mitigating policy measures are removed, guess what? That's when we would be pulling back those measures. But right now it's too soon. Lacey, anything you wanted to add on either of that?
I think overall you covered it well. I also want to remind people that, we were able to keep our economy fully open, and our schools started the school year in full in-person instruction because of the combined power of masks and vaccination in our state. Whereas in prior waves, we've had to reduce occupancy and even, completely close some indoor activities. So, these are two powerful tools we have. And as Dr. Shah said, we're always looking at the data and always looking forward and wanting to stay on that forward path. So it is too early to make those changes now. Hopefully we'll keep on a downward trajectory and we'll have that opportunity in the future.
Thank you. We have 10 minutes left in the briefing and 2 reporters left in the queue. Going now to Nicole from Cairo Radio. Go ahead.
Good morning. I'm wondering why it's so difficult to get Pfizer booster appointments and shots. And my mom recently made an appointment, and she just had a heck of a time finding one that's available. But yet it seems like when it comes to first and second doses, of course, we have such an abundance that, we're having to, or such an abundance compared to the people taking them, that we're having to give away prizes and things to get people to take them. So is there any way that some of those first and second doses could be moved over to the booster pile or anything like that? Or do you expect that the booster shots are going to increase in the coming weeks?
Well, thanks for that question, Nicole. There is no difference between the Pfizer doses. We're not dividing them out between first, second, or booster doses. So any place there's a Pfizer vaccine available, you're able to get scheduled for whichever dose you needed. There may be some spot shortages, just depending on what demand is in a certain place, but there is no overall shortage of Pfizer vaccine. And so we ask people to be patient and to try again in a couple of days. If you're not able to get something right away, there is a lot of Pfizer vaccine in our state. And there's a lot of ways that can help you find that vaccine. Again, you can use the vaccine hotline, the COVID-19 hotline number at 833-VAX-HELP. And people can also text their zip code to get vax. The good news is for people who are looking for booster doses is that you have strong protection already, especially against severe outcomes. And so if you have to wait a couple of days to get vaccinated, it's not really increasing your risk of COVID-19 disease. So there's lots of vaccine available, and encourage people, if they're not able to find an appointment right away, to check back in a day or two or use one of those other resources like our hotline to help.
Thank you. And our last question comes from Elise with the Seattle Times. Go ahead.
Hey, good morning. Thanks for being here. I have a couple questions. First, we did already ask about the federal resources coming in, but is it possible to get a few more specifics, particularly how many workers have been approved to come in so far and which two hospitals they're heading to first? And then secondly, what, if anything, is the state doing to hold on to the current healthcare workers here and ensure they are staying in the industry? I'm sure bringing in these ACI workers will help their loads a lot, but are there any upcoming plans for providing further benefits or anything like that to the existing healthcare workers?
Yeah, thanks, Elise, for that. Let me take that second piece out. I know Andy's going to cover that first one about the specifics. No specific plans to additionally support from a state system level. I will say that behind the scenes, the health sub cabinet, as I mentioned, is working very tirelessly on a number of things. For example, patients who are more difficult to leave the healthcare setting because of other social needs, how to get those individuals out, how to transfer patients across different hospital systems to do what we call load balancing, also to get resources in, again, from the federal or other resources. I think one of the things that we've been noting as we're talking to our healthcare partners is that many of those very healthcare systems have actually taken on the ability to incentivize their staff, whether it's behavioral health support, whether it's support by getting traveler type of personnel to come in, temporary personnel to come in, or whether it's some other financial incentives, including sign-on bonuses, et cetera. There are many things that healthcare partners are doing across the system, and we applaud them for doing those things because obviously this is a very difficult time for all of our healthcare workers. And so we do want to make one comment, which is about, we do want to be careful that we don't inadvertently have this system of haves and have-nots from the healthcare system, that if we incentivize too much in one hospital, for example, it draws from other hospitals, let's say, that cannot afford to provide the same level of incentives across the state. And now what you've done is you've created a gap or a hole somewhere else. So this is where bringing in some external support is really helpful. And we also want to make sure that all of our healthcare partners are doing something important and doing something that is really going to help support their healthcare system needs, so that it's not just in one part of the state and now it's just pulling other resources that are hard to plug in. For example, urban areas, hospitals that maybe have more financial resources, pull them from critical access hospitals in rural areas. That is something that doesn't help anybody in the state. We want to make sure that that is something that is also cognizant by our healthcare partners. So I think I covered most of that. I did want to stop for a moment before I get to Andy. Dr. Bell, did you have any comments on that piece? I know, again, in the healthcare system, the incentives is it's really important from a administration side, but anything you wanted to add on that?
No, except to say that I think we share your concerns about the equity issue and about drawing care away from those who may need it most. We're a precious resource, and I think it's not limitless. So we've had to be very intentional about how we've addressed that, and I think we'll continue to need to give it good thought. It's a really important issue for us, for sure.
Thank you, Andy.
Yeah, and on the first one, let me spend a couple seconds just talking about the process to help answer the question. So anytime the state requests federal resources, we request a capability, not a specific resource. So in this instance, what we have been working with our partners to request of our federal partners is hospital surge and decompression support. So that is what our ask is. It is then incumbent upon our federal partners to take that request and find resources that best fit that capability. So that is currently what they're doing right now. They are looking through options, which could be anything from Department of Defense medical clinical resources, the National Disaster Medical System through HHS ASPR that Dr. Shaw mentioned earlier in the briefing, And there's a myriad of options. So that's what they're working through right now. Who is available? What best fits the need? To this moment in time, no specific team has been assigned to either request we have in the system. So there's really not much more specifics there. We hope today or in the next 48 hours, hopefully to have some better information as to the exact team, where they're coming from and what their makeup is. And we'll move from there. I do know our public information team at DOH and our local partners that have put in for these requests already with outreach and press briefings and media briefings and information. Once all of that is finalized, we just don't want to get too far ahead of the cart and start talking about specific resources that we haven't got a guarantee on yet. I hope that is helpful. I know it's a little vague, but more to come on specifics as we get the mission assignment from our federal partners.
Thanks, Andy. So let me just close and I'll turn it back to Julie just by thanking all of our media partners for being here today. I also want to thank those colleagues on the briefing today, Lacey, Michelle, Andy, and certainly Dr. Bell. Thank you for joining us and your insights into what's happening in not just the pediatric world, but also in the healthcare world. Really, really appreciate all the work that you and your colleagues are doing and all the staff that you're working with across the healthcare system. Thank you, and thank you. I can't say it enough as a fellow healthcare provider. I do want to say that this is a really important time for all of us. We're seeing progress. We're seeing numbers that are getting better, but we are not out of the woods. We need to continue to stay with the course of the actions and activities that have gotten us to where we are with some improvements in our system. We're doing everything we can at the state to continue to look at all policies that we can review and anything that we can do to enact to help with mitigating what's happening in our system, not just today, but also for the future. And certainly we're doing everything we can behind the scenes with our partners to really support the various systems that are stretched right now, including in our public health systems on the ground, our tribal systems on the ground, as well as our healthcare systems on the ground. So I just want to thank everybody for everything you're doing. Please continue to encourage people to get vaccinated, mask up, and avoid crowds. Do everything you can, especially with the holidays, as Lacey mentioned, right around the corner, including Halloween, by the way. Just the reminder that wearing a mask, a Halloween mask, is not the same thing as wearing a mask that's going to protect you from COVID-19. And we want to make sure that those kinds of messages are out there. And certainly we're going to continue to get those messages on social media and our website. So with that, thank you so much. Thank you to all of our media team as well. And Julie, I'll turn it back to you.
All right. Ooh, right on time too. It is 11 a.m. And that concludes today's media availability. We appreciate all of you who attended, asked questions, and continue to cover the pandemic. Have a great day and we'll see you again soon.
Thank you.